Hi, I'm Parky. I'm a psychologist and I've been practicing evidence-based mental health for the better part of a decade, and I've treated hundreds of patients using therapy strategies. And today I'd like to talk to you about the top 5 tips that I've learned from treating all these patients about how to manage your anxiety. So let's get started. Tip number one is to be a curious scientist. So oftentimes when we're struggling with anxiety, we tend to actually close off our world. We stop doing things that we consider to be potentially uncertain or novel because we worry about the possible dangers of doing that new thing. Like if we were to travel to a new place, we have a what if statement like, what if I end up in a place where I'm isolated? What if there's no help? What if some accident happens and I can't get to safety because I'm not at home? Or if I were to try out for that new job, I'm not going to get it. Or even if I did get it, what if I don't do a good job? What if I don't like the job? So because of all these what if statements, we stop doing things that are uncertain or novel because we worry about what could happen. So we start to shrink off our world. So instead of always assuming the worst case scenario, one thing that can be really important is to actually test these assumptions, these negative, catastrophic thoughts that come up and pop up in our mind. And Ralph Waldo Emerson, an American essayist, actually had a really fantastic quote, which is, all life is an experiment, and the more experiments you make, the better. And this willingness to be a curious scientist is something that I try to elicit with my patients to very positive results. And the actual CBT or cognitive behavioral strategy this is called is a behavioral experiment where essentially we're asking the question, well, you know what? Like, I don't actually know what is going to happen. Like, I have this catastrophic thought as to what might happen, but maybe I can test that prediction. What will actually happen if I were to do that thing anyway? And the great thing about behavioral experiment is that uncertainty is all around us. We can make experiments out of pretty much everything. Like we can start something small, like maybe we're just gonna see what would happen if we were to try out a new bubble tea flavor or try out that new restaurant, or what would happen if I went to watch that movie alone instead of with a friend where people make fun of me. So these can be like very low stakes experiments that you can incorporate. And then as well, you can kind of start to build up that hierarchy and make more high risk decisions like traveling to a new place by yourself or starting a new job. All of those things allow us to kind of take a different perspective or stance to uncertainty and give it a shot and see what happens. And the more experiments that you conduct, the more you're able to recognize that uncertainty is not inherently dangerous. It's actually a rather neutral term, and sometimes it'll be negative, but it'll also sometimes be positive, or it'll be somewhere in between. And even if it is negative, one thing you're going to recognize is that you can cope with uncertainty, you can deal with it, and you're capable and effective to be able to handle life stressors. And when you're able to take on that resilient framework, anxiety is going to be a lot less impactful to you. The stressors are going to be a lot less impactful to you. So, somewhat aligned with tip number one, tip number two is to avoid avoiding. So, whenever we're avoiding something, we reduce the stress in the short term, but maintain it over the long term. Like if we have a phobia of dogs, if we're always avoiding spending time with dogs or avoiding even pictures of dogs, we're gonna continue having that fear of, if I were to spend some time with a dog, it's gonna be dangerous, they might hurt me. So the anxiety is always gonna continue to spike up, and you're never getting a chance to actually naturally reduce because you're artificially reducing it by getting out of this situation. And this maintenance of anxiety through avoidance happens in all different situations. It can be about dogs, but it can also be about social situations like presentations or parties. It can be about obsessive compulsive related issues like, always washing your hands right after engaging in that compulsion, after noticing the sort of intrusive thought of like feeling dirty or feeling like you're going to get sick. So these kind of avoidance traps that maintain anxiety in the long term can happen in many different facets of our lives. So in order to avoid avoiding, we have to be able to face our fears. And this doesn't have to be a torture chamber where you're going for the scariest thing right at the outset. Like you don't have to go to a party and confess to your crush. You can start by interacting with your Uber driver or saying hello to the cashier and saying, how are you? In the context of contamination related OCD issues, instead of like touching the scariest thing you can think of, the most contaminating thing you can think of, you might be touching, I don't know, like a floorboard that you feel like is a little bit dirty and spending some time with that distress rather than immediately going to wash your hands. So you're allowing yourself that time to sit with the discomfort, allow our brain to get some new learning as to what would happen if you were to sit with the distress, and allow it to kind of reduce over time. So a third tip that I found very helpful with my patients is actually change our relationship with anxiety. So oftentimes people who are very anxious have a very negative relationship with their anxiety. They're kind of thinking, oh my gosh, like my anxiety's here again. It's so annoying. It always stops me doing the most important things in my life. Like I hate it. And one thing that can be really helpful to, instead of kind of resisting the anxiety, but rather kind of roll along with it, is to be able to kind of say and identify that anxiety can actually serve a very helpful function. Like there's a reason why we all feel anxiety from time to time because it serves to protect ourselves from potential dangers and threats. So in the olden days, it might be a bear attack, but in current days, it might be related to our social status or a presentation that we want to do well on. And one thing that can be really helpful to not add fuel to the fire is to actually thank our anxiety for being here, to say, hey, thanks for being here and telling me that this is something that's very important to me. But you don't have to blare so loudly today because I think I'm going to be prepared. I know what to do to make sure that I'm going to be properly prepared for the situation. So thanks for being here and I'll see you soon. And one thing you might recognize or notice is that oftentimes when you're feeling depleted, like you didn't have a good night's sleep, you're very hungry, maybe you just had sort of an argument with someone like a friend or a partner, you're going to be kind of like exhausted and the little things are going to impact you even more. Like something that normally wouldn't have bothered you too much actually starts to generate a lot of anxiety. So, based on that idea, lesson number 4 then is to make sure that you're engaging in activities that are nourishing for you, kind of related to self care. So, this could be doing something every day that gives you nourishment, gives you kind of energy and resilience and resources to deal with life stressors. So, that could be very different from person to person. For some, it could be related to doing a 5-minute meditation exercise every day. Others, it could be going to take a walk or getting their favorite beverage at a Starbucks or their coffee shop. Whatever that is for you, to do something that's intrinsically nourishing, intrinsically related to self-care, so that when you're dealing with these stressors, you have the energy and resources to handle the stressors without feeling like you're going from 0 to 100. And if you are interested, I do have a couple of meditation tapes that I could put at the end of today's video so that if you do want to do a little practicing, you'll have a resource to do so. The fifth and final tip that I found very helpful with patients, especially those that deal with more panic related disorders, so people who kind of worry about their symptoms being something more dangerous, is actually to work around and work with our symptoms of anxiety itself and our experience of the symptoms of anxiety. So, one thing that we can even do in this moment is that if you might be noticing and you're watching this video and you're noticing some symptoms of anxiety, like maybe you're thinking about, oh, I have this homework or assignment that I need to do later, or these other things I'm doing and I'm just procrastinating by watching this video. Maybe you're noticing some of that anxiety, and to see if you can actually curiously notice and sit with those symptoms and then relate to them a little bit differently. So, noticing if there's any butterflies in your stomach, or maybe your shoulders are kind of tense, or you're noticing that the distressing feeling comes from your throat feeling closed or it's on your face, whatever that might be for you, to be able to sit there a little bit more with that experience and see if you can give some compassion to the experience itself. Is there a way for us to relate to these symptoms differently so they're not so distressing, and to say, okay, so this is my experience. I'm noticing some butterflies, noticing some tenseness. I'm noticing my fingers and hand are a little clammy, and see if that can just be your experience and have that be okay. And I find this approach to be very helpful because it allows for us to have the experience of distress related to the anxiety, but we're not adding too much fuel to the fire. We're not saying, oh my gosh, like this experience is so intolerable, unbearable. I need to get away from this moment immediately. It's more like, yeah, this is my experience right now. Does that stop me from doing the things that are important to me? It doesn't have to. And even if this is kind of painful in the moment, I don't have to let that pain turn into suffering. So there you go. Those are the top 5 strategies that I found most helpful with my patients. So hopefully they were helpful to you too. And if you did enjoy this video, I encourage you to subscribe because I'll continue to talk more about evidence-based mental health and different strategies that you can apply into your life or your mental health journey down the road.